All right, and good afternoon. I'd like to welcome and introduce again Dr. Robert Murphy, Executive Director of the Robert J. Havey, MD, Institute for Global Health, and the John Philip Fair Professor of Infectious Diseases here at Northwestern Steinberg School of Medicine, who answers your COVID questions and addresses the latest COVID headlines every Tuesday and Thursday here on the Havey Institute for Global Health's Facebook page. And today, Dr. Murphy will be answering viewer-submitted questions and addressing the latest COVID headlines through today, the 21st of October. And we invite you to continue to submit your questions to us via Facebook at NU Institute for Global Health or by email at globalhealthinstitute@northwestern.edu. And leading the discussion today is Sophie Piskowski, who is a student research assistant with the Institute. So Sophie, I now turn it over to you.
Thank you, Kristen. Hi, Dr. Murphy.
Good morning.
So for some updated statistics, we have 57.3% of the United States population fully vaccinated, which is exciting. And we are now under 90,000 daily average positive cases. We are seeing a 22% decline in cases over the last 14 days in the States. Florida and Texas are seeing a massive decline, but we are seeing an increase in cases in Colorado and in Michigan. In Illinois, 54.4% of the population is fully vaccinated. Yesterday, there were 2,000 cases, and we are seeing a 21% decline over the last 14 days. What can you tell us about the majority of states declining in cases, but there being a select few cases that are in a select few countries that are increasing in cases?
Yeah, the United States is geographically and population-wise, a huge country. It's one of the largest countries in the world, obviously. And there's many differences between regions. As a country, we're doing better. We're coming off this fourth wave. The overall national numbers are going down, but this is not the end of the pandemic. We're at the end of the fourth wave. The question is, are we going to have a fifth wave? And I think what we're seeing now in some of these states, like Michigan, where I'm sitting right now, or Minnesota, and several other states, they're having increases. In Michigan here, the increase, it's the people testing for COVID, it's 10% positive. This is going in the wrong direction in certain areas. So why is this happening? Okay, it's a diverse place, number one. Number two, some places, they gave up the mitigation recommendations too soon, and they didn't put them back in when they saw the numbers going in the wrong direction. And, you have the rest of the country opening up, and then you're going to have states that are actually sort of shutting down. I mean, we don't have to have a total shutdown, but we know the mitigations work. And then at the bottom of the whole thing is this vaccination rate. It's too low. 57% is not enough. This is a highly contagious disease. We probably have to have maybe as much as 90% of the population vaccinated. This is men, women, and children. We're nowhere near that. Matter of fact, compared to other wealthy countries in the world, our peer countries, we had been the lead in getting vaccinated, and now we're at the bottom. The other countries are doing much better. In Europe, it's hovering around 70%. In other areas too, even higher than that. And they are seeing genuine declines throughout their countries. Now, their countries are much smaller geographically and population-wise, so we have to be a little bit careful. We have to look at the countries a little bit more like states. But anyhow, the vaccination rate has got to get up, or we're going to have a fifth wave.
Yeah, absolutely. And speaking of vaccinations, with some very exciting headlines of the FDA authorizing Moderna and JNJ boosters and allowing a mix match booster strategy. What can you tell us about the mix matching and what that's going to look like?
Well, this is really good news. It's based on science. We know we need a booster. That we actually knew a couple of weeks ago, and the EUAs were changed for Pfizer and Moderna, and now for JNJ. But at the same time, the NIH sponsored a study in 10 hospitals looking at patients who, in an organized scientific way, mixed and matched. And they found that the people that mixed had a better response, particularly from the Johnson & Johnson vaccine, and they got boosted with the Moderna. The difference was quite dramatic. I mean, a 76 times greater increase in the antibody level if they got the Moderna booster compared to the J&J booster, which was only 4 times. Now, 4 times may be enough, 76 times? Wow, that's a big difference. And so there's differences with the other vaccines. Almost everybody that mixed had a slightly or a greatly increase in the number of these antibodies, which are very important. But the antibodies are not the whole story either. But that's why even people who don't get a booster, fewer of them land up in the hospital and fewer of them die from COVID. But as we saw this week, Colin Powell, 84 years old, had the vaccine, he died, but he had underlying severe disease as well and was 84 years of age. So anyway, so the mix and match thing is a great thing. Now remember, the Moderna, on top of everything else, the Moderna booster is now at half the dose. They didn't see a big difference between the full dose and the half dose, so the half dose theoretically will be better tolerated. And that's theoretical at this particular point, but it works just as well at the half dose level. So we'll see how that plays out. For one thing, it's going to give us twice as many vaccines to boost people with.
Yeah, absolutely. And as you mentioned earlier, while Europe has a very high vaccination rate, the UK is seeing one of the highest COVID infection rates in the world right now, if not the highest. What can you tell us about what's going on in the UK right now?
Well, there's never one reason why this is happening. The UK, when their numbers started going down, this is now like 2 months ago, they basically threw away the mask and opened the doors, and there were pent up demand to let's go out there and just be normal again. So they loosened the mitigations a little bit too fast. The other thing that's happening there is they have their Delta variant has developed another mutation. So it's sometimes called Delta Plus, but that could have something to do with this. We don't know, but the virus is always going to be changing. The other thing is a lot of the vaccines that, the AstraZeneca vaccine and the other some of the other vaccine approaches that they took there, they were mix and matching a long time ago, by the way, just because they didn't have enough vaccine. But, maybe some of the vaccines they use in the population are not so good. And then they have been reluctant to vaccinate the adolescents, people, under 16 or 18 years of age. And so, you put all that together and you're seeing this huge uptick. I mean, per capita, it's really doing terrible there. And so everything is there's so multiple reasons. It's like why planes crash. Planes don't crash just because there's bad weather or if one minor equipment failure. But if there's equipment failure, bad weather, and the pilot's not paying attention, boom, that's when accidents happen. And, that's very rare with airplanes, by the way, but it's always like 3 things go wrong for a plane crash. And that's what's happening in the UK now. There's definitely like a bunch of things not working well. So they've got to get their act together, get the mitigations back in place, get everybody boosted with the vaccines, get the teenagers and the children vaccinated.
Right, right. And another place that really isn't doing well is Michigan right now. I know you touched on this a little bit earlier, but can you give us a little more detail about what's going on in Michigan these days?
I don't really know. There's very little mitigations in Western Michigan and Central and Northern Michigan. Detroit and the counties right around Detroit are actually doing pretty well. So it's kind of the same thing we see in Illinois, where Chicago's doing pretty good. And it's the rest of the state, particularly downstate, that is not doing great. The collar counties doing okay, some of them doing even better than Chicago. So, it's the urban areas of some places, I don't know if they have stronger public health departments, the people are being more careful, they're being more cautious. I know when I'm in Chicago, when I'm in the city, a lot of people are wearing masks everywhere, in stores, schools, people are much more careful. In the countryside here, and I'm in rural Michigan and Western Michigan right now, it's very lax. I go in one store and, none of the employees are wearing masks and about half the customers are wearing masks. I mean, what is this going to do? This is not going to help. I go in another store and all the employees are wearing masks, which is good. But still, about maybe a third of the customers are not. It's not mandated. It's recommended. They got to tighten things up, and that's going to slow it down.
Yeah, Absolutely. And now for some questions. Can you tell us, Dr. Murphy, a little bit about reactions from the second vaccine and what people should do if they had a reaction about the third, so the booster? This individual had Moderna. After their first vaccine, they were tired, but after the second vaccine, within minutes, their heart started to race, their blood pressure went up. They ended up having to go to the ER, their blood pellets dropped. What can you tell us about what's safe to do if you've had such a strong reaction with the second vaccine?
Well, the Moderna is a strong vaccine. And this person ended up in an emergency department. I would say that it's not a full-blown anaphylactic dangerous reaction, but it certainly was a severe reaction. Now, there's a couple things going on. One is the Moderna vaccine is going to be half the dose. So maybe this kind of reaction isn't going to happen, and they're only going to get one shot. It's not like a double in a row. However, there's an alternative, and that's take the Pfizer vaccine. So it's been shown that mixing and matching is okay. It's maybe even a little bit better. And so I would say, this person maybe had a bad reaction to the Moderna vaccine. It is a different vaccine. It's the same type of vaccine, but it's different. I think they should take the Pfizer booster. They should consider it. Talk to their doctor and discuss which one they should take, but my recommendation would be to take the Pfizer vaccine.
Yep. And this individual are both ages 70 years old. They both received their second Moderna vaccine at the beginning of March of 2021. Last month, they both had breakthrough cases of COVID. How do they know if they have immunity from the virus? And do they still need to get the Moderna booster, being that they had COVID last month?
Yeah, this question comes up quite a bit. You do get immunity from getting the infection, but the immunity is weaker from the infection than from the vaccine. That's why they had a breakthrough case. Moderna is our best vaccine out there. They have breakthrough. So you're already 6 months, that was March, so September. That person should, once if their breakthrough symptoms are completely gone, they should get the booster too. Then they become what they call a hybrid patient. So they had the vaccine, then they had COVID, and then they get a booster. So they've had everything basically. And these people actually do very well with the booster, vaccine booster. So they should definitely, if they're feeling well now, go get the booster shot.
Wonderful. And now we have some Thanksgiving questions. We have a lot of families that are asking about Thanksgiving. This is a family in particular that has people above the age of 65. Should they get their booster if they want to attend a Thanksgiving event? I would also like to preface that this Thanksgiving event has individuals who are unvaccinated and vaccinated, and these people are above the age of 65. So what can you tell us about spaces like this?
So people really need to be careful with the holidays. I can say this, with the vaccines that we have now, and we know how to slow down the progression of this thing, it can be done safely. But here's how it's done. One, everybody at the event is vaccinated. If people don't want to get vaccinated, they are not invited. They cannot be there. The unvaccinated people are going to drive this pandemic, and these people are high risk because of their age, and it is just not worth it. Time to step up to the plate and say, hey, don't put me at risk. You could kill me. That's one thing. There are some other things you can do. One is if everybody's vaccinated, you can say, okay, everybody get a test the day before they come. And if they're going to be there for all 4 days, they can take another test while they're there. These are over the counter now, rapid tests. If you do 2 of them, it's as good as getting one of those PCR tests. They're not expensive. There is currently supposedly being subsidized by the government so that they're not expensive. And there are places where you can get tested for free. So it shouldn't be an economic burden. So there's all sorts of things that you can do to make this safe. And if anybody's high risk, they should not be mixing with unvaccinated people. That's the big thing.
Yes, and very much tying into another question here. This individual wants to attend a birthday party for a 99-year-old aunt who is vaccinated and receiving her booster. But once again, individuals in an enclosed space who seem to be some vaccinated and some unvaccinated. We don't know the ages of these people, but 99-year-old aunt. Can you tell us a little bit more about spaces like these?
Yeah, it's basically the same answer. And here you have a 99-year-old. She's making dinner. This woman must be in fantastic shape. Good for her. I mean, you know, hey, you're 99. Like, you're making dinner for these people. Again, everybody vaccinated. And if you're eligible for a booster, you take the booster before you come to this. You don't want to hurt this lady. Who wants to hurt this lady? Nobody wants to hurt this lady. Unvaccinated people are not welcome. They cannot come. They're going to have to do by video or telephone. Otherwise, they're putting these people too much at risk. It's kind of risky enough getting together with a 99-year-old. I mean, you know, the immune system is just not the same. So it's basically the same answer as before. Only vaccinated people take the booster. Depending on how big the party is, you can get a test beforehand. And if it goes for more than a day or two, you can have another test while you're there.
Yeah, absolutely. So we have an individual asking about the benefits and the possibilities of mixing the J&J vaccine with the Moderna. What are you expecting for people like this individual who originally got Moderna vaccines? Which type of booster should they get and receive, and when should they get it in terms of the J&J?
So this is the big decision that everybody has to make now, because ultimately they're going to remove all the restrictions on this booster thing. It's crazy they did what they did, but they did. So, you know, it's now limited who can get the booster, but that's going to change. So the Moderna vaccine appears to be the strongest vaccine. The antibodies anyway hold up. The hospitalization and death rate is basically the same. But who wants to get even a breakthrough infection? Because breakthrough infections, you can infect other people. Who wants to end up in a hospital? Nobody wants to end up in a hospital. So anyway, Moderna is a great vaccine, and they should be, this person is vaccinated with Moderna. The booster is going to come out at half the dose, or is, I'm not sure if it's on the shelf yet, but it's going to be approved for half the dose. And they should go ahead and just get the Moderna vaccine, the Moderna booster. If for some reason it's not available, they can take the full dose, or they can take the Pfizer vaccine, either one, the mix and match approach. I don't think the Johnson & Johnson vaccine will help this person. So they have to stick with the Moderna or the Pfizer. So they have a lot of options.
Absolutely. And for our last question, also regarding booster, this individual says, Dr. Murphy has said in the past that infection is not a substitute for the vaccine, but infection does offer protection for a while. I was fully vaccinated in April and had a relatively mild breakthrough infection in September, including spreading to another vaccinated family member. Respectively, we are not eligible for a booster. If we were eligible today, if or when would you recommend we get the extra dose?
This is why everybody needs a booster, and not just people over 65 or people with underlying medical conditions. This is exactly the case that we don't want to happen. These people under 65 who were otherwise healthy are getting breakthrough cases, and they're spreading it to other people. Come on, as soon as this person is eligible, they should take a booster.
Wonderful. And those are all of our questions for today. Thank you, Dr. Murphy.
Great. Have a great day.